is Josh. Today I will be conducting my cognition focused assessment. So first thing we do before entering a room is we always wash our hands. Enter the patient's room. Hello, my name is Josh. I'll be your nurse today. Today we are going to be doing a cognition assessment. Can I see your wristband, please? What's your name, date of birth?
Haley Huddleston, 52794.
Sounds good. Patient is alert and engaged. I do have the correct patient, so that's always good. So I'm going to ask you questions. Do you know what you're doing here today?
Cognition assessment.
Do you know where you are?
The doctor's office.
Do you know what today's date is?
November 21st, 2019.
Sounds good. Patient is alert and oriented ×4. So like I said, today we're going to be conducting a focused assessment. It normally takes about 20 minutes. If you feel uncomfortable during the exam at all, just please let me know. Also, we ask that patients empty their bladders prior to the exam. You will be provided a gown that you're just going to tie up in the back. And then is the privacy okay for the room? Do you feel comfortable?
Yes.
Sounds good. Patient understands purpose of the exam and does feel comfortable with the privacy of the room. So I'm going to ask you some questions. Do you have any frequent headaches?
No.
No frequent headaches, that's good. Any muscle tingleness, weakness, anything like that? Okay. Do you have any problems moving around throughout the day, getting around?
No.
Sounds good. Do you have any loss of consciousness, blackouts, any history of that?
No.
Okay. So patient denies any neuromuscular complaints, and if she did, I would use Olcart's ICE or a more age-appropriate scale. Patient also responds to my questions appropriately. Speech is coherent, it's appropriate to volume, and it is free of stuttering. So first thing we're going to do is you're going to stand up and just walk towards me normally. Okay, turn around. Walk the other way. Okay, go ahead and take a seat. So patient maintain upright posture and balance while walking unaided. Next thing we're going to do is we're going to look at your eyes. Go ahead and cover your right eye with that, please. So we're doing a peripheral vision test. So you're going to tell me when you see the finger out of the corner of your eye.
Okay. There.
Cool. Let's switch eyes for me, please.
There.
Okay. Patient's peripheral vision is appropriate to the examiner's vision. Next thing we're going to do is observe the position and reflection in your cornea. So what we're going to do is you're going to fix your gaze on a point across the room. Go ahead and just look at the light switch, that's fine. I'll be shining a pin light in your eyes, and you're going to keep your focus eyes on that distance.
Okay.
Okay? Looks good. The corneal light reflection is in the same location bilaterally. Pupils equivalent round and react to light appropriately. So next thing we're going to do is you're going to focus your eye on the pen, and then you're going to continue to move, excuse me. You're going to focus your eye on the pen, and as I bring it to your nose, sounds good?
Yeah.
Good. Looks good. Tracking is smooth and coordinated. Next thing we're going to do is you're going to keep your eyes focused on my pen as I move it forward. Follow it with your eyes, but don't move your head. Good job. So like I said, your tracking is smooth and coordinated. So next thing we're going to do is we're going to clench your teeth for me. Looks good. Raise your eyebrows. Close your eyes tightly. Okay. Puff out your lips. Okay. Now puff out your cheeks. And show me your teeth. And smile. Smile. Patient is able to perform movements as instructed. So next thing we're going to do is you're going to open your mouth and say, ah.
Ah.
It is symmetrical. Upper movement is soft and palate and uvula. So next things we're going to do is we're going to check your shoulder strengths.
All right.
You're going to shrug up, but you're not going to let me push you down. Okay? Looks good. Patient is able to shrug, is smooth and equal bilaterally, straight is 5 out of 5. So next thing we're going to do is you're going to stick out your tongue, move it up, down. Okay, left, right. Okay. Tongue is symmetrical and movements are symmetrical as well. So next thing we're going to do is you're going to stand up again. I'm going to stand there. You're going to walk heel to heel. Yeah, you're just going to walk heel to heel, straight back to me. Yep. heel to toe, excuse me. Walk forward. Okay. Okay, go ahead and turn around. And walk back, please. Okay, looks good. Go ahead and take a seat. Next thing we're gonna do, your balance. Patient's balance was good and she was able to maintain her heel to toe position. Next thing you're gonna do is you're gonna stand with your feet together. Go stand right in front. Keep your feet together and your arms on your sides and close your eyes. Okay, looks good. Patient had good balance and position was maintained. Next thing we're gonna do is you're going to stretch out your arms. Okay, once you stretch out your arms, you're gonna touch your index fingers with your nose. And left, your right. Okay, now your left. Okay, looks good. Patient is able to touch nose using index finger with alterations in the rhythmic manner. So next thing we're gonna do is you're gonna hop on the table and lay down for me. So what you're gonna do is you're going to use your opposite leg and move it down your shin, the back of your foot. And the other foot. Okay, looks good. Patient was able to run heel down the opposite shin. So go ahead and sit up for me back over here. Okay, so next thing we're gonna do is I'm gonna use this pencil. It has a sharp end and a dull end. First thing we're gonna do is you're gonna close your eyes. And I'm going to touch random parts of your body and you're gonna point to where I'm touching. Okay. Okay, good job. Patient was able to identify all the areas that I touched appropriately. So now we're going to test your sensation and pressure. I have a sharp end of the pencil and a dull end. I'm going to touch the same areas again and you're going to tell me if it's sharp or dull. Okay?
Sharp, 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 dull, sharp, dull, dull.
Okay, sounds good. Patient was able to identify touches were appropriate if they were sharp or dull. Next thing we're going to do is we're going to check your reflexes.
Okay.
So we're going to check your legs and then your arms. So just go ahead and relax. Make sure you're not holding it up for me, thank you. Oop, there's one. There's two. There we go. Bicep reflexes are equal to plus as long